Hi, my name is Rhonda. I'm one of the pharmacists here at the hospital, and during your hospital stay, your doctors ask the pharmacy staff to help in dosing one of the medications that you're on. It's a medication called warfarin or Coumadin. And in your case, they're using it to help thin your blood so that you don't get any blood clots in your legs after your surgery for your hip replacement. You may have known other people that have been on this medication before, and I just want to go over it with you so you know everything you should know about this medication before you're discharged. So this is one of the medications that we don't want your blood too thick and we don't want it too thin. So it's one of the medications that we draw labs on. We take a little bit of blood and measure a value to make sure that we're in that range that we want it to be, and that's called an INR. And for you, the doctors have decided that they wanted your INR between 1.8 and 2.5. So currently your INR is 2.01. So you are right where they want you, and they're going to send you home on this medication for an additional 2 weeks of therapy. So the dosage that you've been getting in the hospital has been 2.5 milligrams. So we're going to send you home with that prescription for 2.5 milligram tablets, and you're going to have to take one tablet every single day by mouth. And it's best to take the medication around the same time each day. We're going to give you today's dose in the hospital before your discharge. So we'll give you that prescription today when you're discharged, and that way you have a full day to pick up your prescription, but you'll need to start taking it tomorrow. And as I mentioned earlier, the physician said that he wanted you to take the medication for an additional 2 weeks of therapy. Now there's a couple things with this medication. It does interact with some food, alcohol, and other medications. So first of all, it's really important that you let your pharmacist or any other physician that you would see that you are taking this medication, even if it's just for an additional 2 more weeks. First, it can interact with some food that you eat, and it's not a bad interaction, but with green leafy vegetables, they have vitamin K in the leaves, and broccoli and cabbage are an example, but most green leafy vegetables have some vitamin K, and they can cause this medication to not work as well. So we would just like that you try to be consistent. So instead of having a big salad and lots of broccoli on one day and then no vegetables the next day, just try to have the same amount of vegetables with each day would be what we recommend. And also is the same with alcohol. If you drink a lot on one day and not a lot any other day of the week, it can affect that INR value we talked about, and maybe put you at an increased risk for bleeding.